It's August 31st, tomorrow, September already. We've been in this pandemic madness for half a year, which is odd. All they told us was 2 weeks to flatten the curve, 2 weeks to slow the spread, by which they meant it's impossible to stop the spread of a virus unless we literally shut down life and all social interaction. But if we slow down the virus, it won't overwhelm our hospitals. And the 2 weeks part, they said that was the time it took to incubate the virus, so 2 weeks was enough to see if we could do it. Turns out there was never actually a curve to flatten. Justin Trudeau and Theresa Tam followed panicky public health models that said we'd have between 50,000 and 350,000 deaths from the virus. That would overwhelm our hospitals, but in fact, the total number is about 9,000, and that includes a death for any reason where the person also happened to have the virus. So they'd count a heart attack as a virus death. The other day when I was researching virus deaths in Alberta, I learned that even at the maximum, the peak number of patients in that province who were in intensive care units ever, province-wide, was 22. In the whole province, it never got higher than that. Here's the latest stats. Literally 7 people in the whole province in ICU. In a province of 4.5 million people, there is one single person in all of Calgary in intensive care. Calgary, a city of 1.3 million people, there's one in ICU. But as our friend Mark Morano told us last week in a chilling interview, this is the new thing. It has replaced climate change as the universal panic that politicians will use to control us, because people are actually scared of it in a way that no one really believed the global warming stuff. No one actually believed all that. No one changed their lives as if they truly were worried about global warming. But people are panicking about COVID-19, which is no deadlier than the annual flu. So it's going to replace global warming as the excuse to do anything and everything, from new spending and new taxing and new borrowing to suspending your civil liberties. Forget the Green New Deal. No one ever really was revved up about that. Forget Greta Thunberg's school strike. That was just a circus act. But this pandemic, it's the big thing. It's going to be made permanent.
They're talking about the next phase lockdown. Joe Biden's talking about a federal lockdown in January if the scientists say it's necessary. Yeah. Why would it be necessary? To get cases down to 0? And there's no evidence that lockdowns work. There's 0 evidence that masks work. Masks actually the other way, even in hospital settings. Cases of influenza and viruses go up because people end up either not taking the other protocols, or they touch their face. A mask makes your face a target for your hands, which have many viruses. So going back to the 1970s, masks studies actually show that masks aren't effective in preventing viruses, yet they're now mandated across the country.
I'm depressed by this. I see that most people believe that mandatory masks are BS. That's how I sense the people I encounter. But if they're forced to wear it, well, they want you to be forced to wear it too. Some people take the opposite approach. If they see you not wearing a mask, they feel permitted to be a dissident too. But far more, in my observation, people hate wearing the mask, and they hate that they have to submit to it. So if you don't submit to it, in some ways you're shaming them because they're so submissive. So they're mad. They go into full Karen mode, scolding, tattling. I hate it because it's turning people against each other. It's turned people into informants and snitches and scolds and tattlers because they don't want to wear the mask, but if they do, then you have to also. That's an excerpt from my daily show, the Ezra Levant Show. Every day I do a monologue on the news of the day, then I interview an interesting guest, and then I read my hate mail. You gotta subscribe. Go to rebelnews.com.